Thank you for participating. This is working with clients who are positive COVID-19. This course focuses on policies and procedures to be implemented when caregivers assist a client who is positive for COVID-19. This includes learning what COVID-19 is, how it is spread, and ways to protect the HCA and others from exposure to COVID-19. By the end of this course, you'll be able to explain what COVID-19 is, describe how COVID-19 is spread, implement positive COVID-19 policies and procedures, perform the standard precautions recommended to prevent exposure and transmission of COVID-19, put on correctly an N95 respirator. Lesson 1, what is COVID-19? By the end of this lesson, you'll be able to define what COVID-19 is, list the symptoms of COVID-19, understand how COVID-19 is spread. Please refer to page 2 of your student guide. What is COVID-19? COVID-19 is a new disease caused by a novel or new coronavirus that has not previously been seen in humans. Reported illnesses have ranged from mild symptoms to severe illness. The following symptoms may appear 2 to 14 days after exposure: fever, cough, shortness of breath. Emergency warning signs for COVID-19 requiring immediate medical attention are not limited to, but include difficulty breathing or shortness of breath, persistent pain or pressure in the chest, new confusion or inability to arouse, bluish lips or face. How COVID-19 is spread. The virus is thought to be spread mainly from person to person, between people who are in close contact with one another within about 6 feet, through respiratory droplets produced when an infected person coughs or sneezes. These droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. The CDC currently reports airborne transmission over distances is unlikely. With droplet transmission, the droplets containing the germ do not remain suspended in the air. It may be possible that a person can get COVID-19 by touching a surface or object that has the virus on it, and then touching their own mouth, nose, possibly their eyes. But this is not thought to be the main way the virus spreads. Lesson 2, positive COVID-19 policy and procedure. By the end of this lesson, you'll be able to follow positive COVID-19 policy and procedure, apply standard precautions recommended to prevent exposure and transmission of COVID-19, understand what personal protective equipment are to be used when working with a positive COVID-19 client. Positive COVID-19 policy and procedure. Page 3 of your student guide. Limiting close contact, following standard precautions, and using personal protection equipment, PPE, are key safety protocols for serving anyone with an infectious disease. While in-home caregivers are not healthcare providers and do not face the same risks inherent in hospital setting. The same recommendations and PPE requirements used by healthcare providers as recommended by the Center for Disease Control, CDC, will be used. The CDC website will be monitored for changes in recommendations. This policy will be amended as necessary based on those changes. Let's review guidelines for limiting close contact. Close contact is defined by local public health departments as being within 6 feet of a positive COVID-19 person for 10 minutes or more. This is the threshold used for determining if someone exposed to someone who is positive COVID-19 needs to be isolated. The first step in limiting close contact is to alter the regular schedule to only provide essential services and shorten visits for the duration of the time the person is contagious. Use a 2-week period to be safe unless informed by the local health department or primary care physician. Approach this 2-week period the same way you would during a weather emergency, limited to essential services. Work with the person served and any collateral contacts to come up with a 2-week schedule which safely covers all critical needs while limiting contact. Limiting close contact can be done by either physically separating oneself as much as possible, preferably at least 6 feet away. The positive COVID-19 person should remain in a separate room with the door closed if at all possible, while tasks are performed that do not necessitate the positive COVID-19 person's close presence. The positive COVID person should wear a surgical mask while care is provided. All personal care tasks involving close contact should be prioritized and only performed if necessary. Personal care tasks which necessitate close contact should be done with very strict adherence to the personal protective equipment recommendations. Tasks should be altered to support the client's independence or altered in a way so the task can be complete with the caregiver's assistance in less than 10 minutes. All essential shopping should be done without the client present, even if the client is feeling better, until the time period in which the client is contagious has lapsed. The need to limit visits during the time of contagion is an important step in preserving the supply of N95 respirators in stock. N95 respirators can be used a maximum of 5 times if covered with a surgical mask. Ideally, it is recommended to limit visits to 5 during the 2-week period, or period which the health department or primary care physician states the positive COVID-19 person is contagious. Staff who work around positive COVID-19 people will be informed of any changes to the regular schedule, as well as the duration of the expected changes. Staff may refuse to serve a client who has a contagious disease. Please refer to page 4 of your student guide. Let's review guidelines for following standard precautions. Standard precautions are used for all client care. They protect healthcare providers from infection and prevent the spread of infection from person to person. Elements of standard precautions that apply to clients with respiratory infections, including COVID-19, are hand hygiene, cleaning and disinfecting, and use of personal protective equipment, PPE. Let's review guidelines for hand hygiene. Caregivers should perform hand hygiene before and after all client contact with infectious material, before putting on and after removing personal protective equipment, including gloves. With hand hygiene after removing personal protective equipment is particularly important to remove any pathogens that may have been transferred to bare hands during the removal process. Home care aides should perform hand hygiene by washing hands with soap and water for at least 20 seconds or using hand sanitizer with 60 to 95% alcohol. How to wash your hands. Wet your hands thoroughly. Apply soap. Create a soap lather. Keep your hands pointing down. Wash all surfaces of your hands with friction for 20 seconds. Rinse your hands, keeping your hands pointing down. Get a towel, dry your hands thoroughly. Keep your hands pointing down so water does not drain back up your arms. Throw away the paper towel. Get a new paper towel, turn off the faucet, and throw that paper towel away. Please refer to the bottom of page 4, top of page 5 of your student guide. We're going to review guidelines for cleaning and disinfecting. Clean and disinfect all high-touch surfaces, such as counters, tabletops, doorknobs, bathroom fixtures, toilets, phones, keyboards, tablets, and bedside tables every day. Also clean and disinfect any surfaces that may have blood, stool, or body fluids on them. Use a household cleaning spray or wipe according to the label instructions. Label instructions. Labels of products contain instructions for safe and effective use of the cleaning product, including precautions you should take when applying the product, such as wearing gloves and making sure you have good ventilation during use of the product. If the bathroom will be shared with others in the home, the bathroom will need to be cleaned and disinfected every time after the client uses the restroom. Wash laundry thoroughly. Immediately remove and wash clothes or bedding that have blood, stool, or other body fluids on them. Wear disposable gloves while handling soiled items and keep soiled items away from your body. Clean your hands with soap and water or an alcohol-based hand sanitizer immediately after removing your gloves. Read and follow directions on labels of laundry or clothing items and detergent in general, using a normal laundry detergent according to washing machine instructions, and dry thoroughly using the warmest temperatures recommended. Please refer to page 5 and 6 of your student guide. PPE. The CDC has specifically indicated the types of PPE healthcare providers should use in working with people who are positive COVID-19. The PPE recommended when caring for a client with known COVID-19 includes respirator and face mask. Put on a respirator, N95, and surgical face mask before entry into the care area. Note, if a surgical mask is worn over a respirator, the respirator can be worn up to 5 times. Use the CDC-approved surgical mask respirator combination in order to extend the stock of our respirators. Eye protection. Put on eye protection upon entry into the care area. Personal eyeglasses and contact lenses are not considered adequate eye protection. Remove eye protection before leaving the client room or care area. Reusable eye protection must be cleaned and disinfected prior to reuse. Gloves. Put on clean, non-sterile gloves upon entry into the care area. Change gloves if they become torn or heavily contaminated. Remove and discard gloves when leaving the care area and immediately perform hand hygiene. Gowns. Put on a clean isolation gown or protective clothing upon entry. When gowns are not available, use gown alternatives. These would not be considered PPE since their capability to protect is unknown. Combinations of layering pieces of clothing can be considered. Preferable features included long sleeves and closures, such as snaps and buttons, that can be fastened and secured. Example, lab coat or similar clothing. These are single-use items, must be removed after leaving the care area, contained in a garbage bag and safely laundered. Disposable aprons are to be worn in addition to protective clothing when providing care with high contact. Aprons are to be discarded after care. Important, all personal protective equipment will be worn during the caregiver's entire shift with a positive COVID-19 client. Disposable PPE such as gloves and aprons should be changed properly if contaminated. We will go over procedures for donning and doffing personal protective equipment later in this lesson. Please refer to page 7 of your student guide. Surgical mask versus respirator. What is the difference? A surgical mask is a loose-fitting, disposable device that creates a physical barrier between the mouth and nose of the wearer and potential contaminants in the immediate environment. These are often referred to as face masks. Note the edges of the mask are not designed to form a seal around the nose and mouth. An N95 respirator is a respiratory protective device designed to achieve a very close facial fit and very efficient filtration of airborne particles. Note, the edges of the respirator are designed to form a seal around the nose and mouth. N95 respirators are not designed for children or people with facial hair. As of this writing, the CDC recommends using an N95 respirator when working in close contact with positive COVID-19 people. The World Health Organization recommends using a surgical mask. 3M 1860 and 3M 1870 respirators, as shown in this document, are on the list of NIOSH approved N95 particulate filtering face piece respirators, as well as the CDC list of approved respirators. 3 key factors required for a respirator to be effective. The respirator must be put on correctly and worn during the exposure. The respirator must fit snugly against the user's face to ensure that there are no gaps between the user's skin and the respirator seal. The respirator filter must capture more than 95% of the particles from the air that passes through it. Lesson 3, wearing PPE. By the end of this lesson, you'll be able to perform a respirator fit test, put on and take off a respirator, understand the sequencing of donning and doffing PPE, clean and disinfect eye protection, perform safe glove removal. Please refer to page 8 and 9 of your student guide. Rules for wearing respirators. The Occupational Safety and Health Administration, OSHA, has rules for wearing respirators. On March 14, 2020, OSHA announced the rules have been temporarily changed to help preserve the supply of respirators. In order for the N95 respirator to be fully functional, a person needs to make sure they know how to properly put on the mask and check to make sure it is sealed. This is called a fit check. While someone would normally be trained to do this and be tested, given the need to preserve N95 respirators and the lack of time, we're providing written instructions for staff to follow. It is critical that anyone who uses a N95 respirator perform a fit check when donning the respirator. A person must have an adequate seal for the respirator to be fully functional. Included in this policy are general instructions for putting on, performing a seal or fit check, and taking off an N95 respirator. Please refer to the instructions that come with the respirator provided. General instructions for how to properly don and doff a respirator. Wash your hands thoroughly before putting on and taking off the respirator. Inspect the respirator for damage. Employees who use N95 respirators should inform their supervisor immediately if the respirator is damaged or no longer seals properly. Do not allow facial hair, jewelry, glasses, clothing, or anything else to prevent proper placement or come between your face and the respirator. We're going to review steps for putting on the respirator. You can follow along with the images in your student guide. Step 1, position the respirator in your hands with the nose piece at your fingertips. Step 2, cup the respirator in your hand, allowing the headbands to hang below your hand. Hold the respirator under your chin with the nose piece up. Step 3, the top strap goes over and rests at the top back of your head. The bottom strap is positioned around the neck and below the ears. Do not crisscross the straps. Step 4, place your fingertips from both hands at the top of the metal nose clip. Slide fingertips down both sides of the metal strip to mold the nose area to the shape of your nose. Checking a respirator seal. You can follow along with the images in your student guide. Step 1, place both hands over the respirator. Take a quick breath in to check whether the respirator seals tightly to the face. Step 2, place both hands completely over the respirator and exhale. If you feel leakage, there is not a proper seal. Step 3, if air leaks around the nose, readjust the nose piece as described. If air leaks at the mask edges, readjust the straps along the side of your head until proper seal is achieved. Step 4, if you cannot achieve a proper seal due to air leakage, ask for help or try a different size or model. Removing a respirator. You can follow along with the images in your student guide. Step 1, do not touch the front of the respirator. It may be contaminated. Step 2, remove by pulling the bottom strap over back of head, followed by the top strap without touching the respirator. Step 3, place respirator in storage container and wash your hands. Note, if a surgical mask is worn over a respirator, remove and dispose of the surgical mask first. The respirator can be used up to 5 times. Important, use the CDC approved surgical mask respirator combination in order to extend the stock of our respirators. This training uses 2 specific N95 masks, 3M1860 and 1870. Follow the instructions that come with the masks on how to put them on and check their fit. In the reference section of the guide are links to videos with demonstrations. We are now going to watch a video that contains fitting instructions for N95 3M 1860 respirator surgical mask.
The 3M 1860 is a cone-shaped particulate respirator and surgical mask. The 1860S is a smaller version of the 1860. Follow these instructions each time you don your respirator in order to achieve a proper fit. Begin by cupping the respirator in your hand, holding the metal nosepiece at your fingertips. The straps should hang freely below your hand. Place the respirator under your chin with the nosepiece up. While holding the respirator in place, pull the top strap over your head with the opposite hand and position it high on the back of your head above your ears. While still holding the respirator firmly on your face, pull the bottom strap over your head and position it around your neck below your ears. Make sure the straps are not twisted for increased comfort. Place the fingertips of both hands at the top of the metal nose strip and mold the nose piece to the shape of your nose using both hands. Push inward while moving your fingertips down both sides of the nose piece. Always use two hands when molding the nose piece. Pinching with one hand may result in improper fit and less effective respirator performance. Perform the following user seal check each time the respirator is put on. Cup both hands over the respirator, covering it as much as possible and being careful not to disturb the position of the respirator. Inhale and exhale sharply. If air leaks around the nose, readjust the nose piece for a more secure seal and repeat the user seal check. If air leaks around the respirator edges, adjust the position on the face and the straps along the sides of the head. Repeat the user seal check. Do not enter a respiratory isolation or other hazardous area where respirators are required until you are assured you have a proper fit. If you have difficulty achieving a fit, review the respirator user instructions located inside the packaging or refer to the instructions on the 3M 1860 Wear It Right poster to be sure that you are following the correct procedure. If you are still unable to achieve a fit, see your supervisor or representative from your infection control, employee health, or safety department. Do not enter a hazardous or infectious area. To properly remove the respirator, do not touch the face piece. Slowly lift the bottom strap from around your neck up and over your head while keeping the respirator seated against your face. Lift off the top strap. Carefully remove the respirator without allowing the outside of the respirator to come in contact with your body, and perform hand hygiene. 3M recommends you practice this removal procedure until you are proficient and comfortable with the procedure and before actual use of the respirator for the first time. Leave the hazardous area immediately and replace the respirator if it is damaged, difficult to breathe through, or contaminated with blood or body fluids. Follow your facility's infection control policies and procedures for guidance on how frequently you should replace your respirator. Follow the proper fitting procedures each time you wear the respirator. When in doubt, review the user seal check instructions. If a proper fit cannot be achieved, do not enter the area requiring respiratory protection. Follow up with your supervisor. Keep in mind that when you are wearing a respirator, it helps reduce potential exposures if the respirator fits you properly. You wear it during all times of exposure, and use of the respirator is under an effective respiratory protection program as required by OSHA 29 CFR 1910.134. Refer to the OSHA website at www.osha.gov for the most current information about use of respirators. Contact your 3M sales representative or call the 3M Healthcare Customer Helpline for information on personal protective equipment, including the respirators described in this training, and to learn more about the other elements of a respiratory protection program.
We're now going to watch a video with fitting instructions for 3M 1870 respirator surgical mask.
The 3M 1870 is a 3-panel flat fold particulate respirator and surgical mask. Follow these instructions each time you don your respirator in order to achieve a proper fit. Remove the respirator from its packaging and hold it with straps facing upward. Place the bottom strap under the chin panel next to the warning statement. Fully open the top and bottom panels, bending the nose piece around your thumb at the center of the foam. The strap should separate when the panels are open. Make certain the bottom panel is unfolded and completely open. Place the respirator on your face so that the foam rests on your nose and the bottom panel sits securely under your chin. Pull the top strap over your head and position it high on the back of the head above your ears. While holding the respirator firmly on your face, pull the bottom strap over your head and position it around the neck and below your ears. Make sure the straps are not twisted for increased comfort. Adjust for a comfortable fit by pulling the top panel toward the bridge of your nose and positioning the bottom panel under your chin. Place fingertips from both hands at the top of your nose and mold the nose piece around your nose to achieve a secure seal. Push inward while moving your fingers down the side of the nose piece. Note, always use 2 hands while molding the nose piece. Pinching the nose piece with one hand may result in improper fit and less effective respirator performance. Perform the user seal check each time you don a respirator. To conduct a user seal check, place one or both hands completely over the middle panel, cupping hands over the respirator and covering it as much as possible. Pay careful attention not to disturb the position of the respirator. Inhale and exhale sharply. Be careful not to disturb the position of the respirator. It is important to have a good face to respirator seal. If air leaks around the nose, readjust the nose piece for a more secure seal and repeat the user seal check. If air leaks around the respirator edges, adjust the position on the face and the straps along the sides of the head and repeat the user seal check. Do not enter a respiratory isolation or other hazardous area where respirators are required until you are assured of a proper fit. If you have difficulty achieving a fit, review the respirator user instructions located inside the packaging or refer to the instructions on the 3M 1870 Wear It Right poster to ensure that you are following the correct procedure. If you are still unable to achieve a fit, see your supervisor or a representative from your infection control or employee health and safety departments. Do not enter a hazardous or infectious area. Properly remove the respirator. Do not touch the facepiece. Slowly lift the bottom strap from around your neck up and over your head while keeping the respirator seated against your face. Lift off the top strap. Carefully remove the respirator without allowing the outside of the respirator to come in contact with your body. And perform hand hygiene. 3M recommends you practice this removal procedure until you are proficient and comfortable with the procedure and before actual use of the respirator for the first time. Leave the hazardous area immediately and replace the respirator if it is damaged, difficult to breathe through, or contaminated with blood or body fluids. Follow your facility's infection control policies and procedures for guidance on how frequently you should replace your respirator. Follow the proper fitting procedures each time you wear the respirator. When in doubt, review the user instructions, including the user seal check instructions. If a proper fit cannot be achieved, do not enter the area requiring respiratory protection. Follow up with your supervisor. Keep in mind that when you are wearing a respirator, it helps reduce potential exposures if the respirator fits you properly. You wear it during all times of exposure, and use of the respirator is under an effective respiratory protection program as required by OSHA 29 CFR 1910.134. Refer to the OSHA website at www.osha.gov for the most current information about use of respirators. Contact your 3M sales representative or call the 3M Healthcare Customer Helpline for information on personal protective equipment, including the respirators described in this training, and to learn more about the other elements of a respiratory protection program.
Please refer to page 10 of your student guide. Surgical masks will be worn over respirators to help preserve our stock. We are going to review instructions for wearing a surgical mask correctly. Step 1, clean your hands with soap and water or hand sanitizer before touching the mask. Step 2, hold the mask so that the stiff bendable strip is on top and the color side faces outwards. Step 3, if the surgical mask has ear loops, hold the mask by the ear loops and place a loop around each ear. Step 4, if the surgical mask has ties, bring the mask to your nose and place the strip over the crown of your head and secure by tying them in a bow. Step 5, if the surgical mask has elastic bands, bring the mask to your nose and pull the top band over your head and let it rest on the crown of your head, and then pull the bottom strap over your head and let it rest on the nape of your neck. Mold or pinch the nose strip to conform to the shape of your nose. Pull the bottom of the surgical mask over your mouth and chin. We are going to now review guidelines for putting on and taking off PPE. Please refer to page 11 of your student guide. Sequencing for donning PPE. The sequence for how one dons or puts on PPE is important. Assemble all PPE, place them on an uncontaminated surface or area, such as place them on a paper towel, wash your hands, and don PPE in the following order. First, put on your apron. Then put on your N95 respirator. Make sure you perform a fit check for proper seal. Put on the surgical mask, then eye protection, then your non-sterile gloves. Sequencing for doffing PPE. The sequence for how one doffs or takes off PPE is important to avoid cross-contamination. Have storage for respirator and eye protection storage near, as well as a second pair of non-sterile gloves. Lay out paper towels for use for temporary place to put goggles or eye protection. Step 1, remove the apron. Pull it away from the body so ties break. Dispose in garbage bag. Remove gloves. Dispose in garbage bag. Eye protection. Place on paper towel. Sterilize after sequencing. Surgical mask. Dispose in garbage bag. Respirator. Place in storage container. If this is the 5th time used, throw it in the garbage. Remove protective clothing. Place in garbage bag and launder safely. After all PPE have been removed, wash your hands, re-glove, sterilize eye protection and place in storage container. Note, keep eye protection and respirator in separate storage containers. Remove gloves, dispose in garbage, wash hands. Please refer to page 12 of your student guide. We're going to review guidelines for cleaning and disinfecting eye protection. When manufacturers instructions for cleaning and disinfection of eye protection are unavailable, such as for single-use disposable face shields, consider while wearing gloves, carefully wipe the inside, followed by the outside of the face shield or goggles, using a clean cloth saturated with neutral detergent solution or cleaner wipe. Carefully wipe the outside of the face shield or goggles using a wipe or cloth saturated with disinfectant solution. Wipe the outside of the face shield or goggles with clean water or alcohol to remove residue. Fully dry. Air dry or use clean absorbent towel. Remove gloves and perform hand hygiene. Gloves. It is important to be mindful about how gloves are removed. Always wear gloves when you do your job, especially personal care tasks and any tasks that could expose you to bodily fluids. How to safely remove gloves. Outside of gloves are contaminated. If your hands get contaminated during glove removal, immediately wash your hands or use an alcohol-based hand sanitizer. Using a gloved hand, grasp the palm area of the other gloved hand and peel off the first glove. Hold removed glove in gloved hand. Slide fingers of ungloved hand under remaining glove at wrist and peel off second glove over fist glove. Discard gloves and waste container. Wash hands thoroughly. At the bottom of page 12. Self-monitoring. Self-monitoring means the caregiver should monitor themselves for fever by taking their temperature twice a day and remain alert for respiratory symptoms, such as coughing, shortness of breath, sore throat. According to the CDC, fever is measured as a temperature greater than 100.3. If the HCA has a fever or develops any other respiratory symptoms, they are to contact their supervisor or CCS management immediately. Thank you for participating in this course. If you have any questions, you are encouraged to speak with your supervisor, management. You can also refer to the CDC for any recommendations or updates they provide.